So this is my portfolio to study for the MB I'm going to start with the basic information. This is going to be the OTPF, so it goes into depth. We will go look into the classification, so we'll be using the WHO to study that. And then the domain, so the area of occupation, climate factors, performance skills, performance patterns, and context and environment. Then we will look into the process of OT. We'll start with the evaluation, and then we'll do the intervention, and then we'll do the targeting outcomes. And then we'll look at the clinical reasoning, so all the different kinds of reasonings there is, and which one will be best for our treatment. And then we will look into the frames of reference, which are multiple frames of reference. So we'll go look into each of them and see what each frame of reference is and what will it do. So there's behavioral, biomechanical, CMOP, and then there's a cognitive behavior therapy, the cognitive disabilities, developmental, EHP, MOHO, NDT, OA, OB, the POP, the PNF, psychoanalytic, and then the rehab, the spatial temporal adaptation, and the sensory integration. So after studying the basic knowledge of OT, I will go and study the motor planning and performance. So I'll start with the neurophysiological approaches. So we'll look into those. And then I will go into the muscle tone assessment, so the different times like hypotonia and hyper. And then we'll use the modified Ashworth scale, so we'll look into that. Remember what grade goes with what description. And I will look into those charts, so we can go ahead and study those. After looking at that, I will go ahead and look at the system-based task related approaches. So there's different models for the system model of motor control, the system model of motor behavioral, the view of recovery after central nervous system dysfunction, and then the evaluation using the system-based task related approaches. So that one is an evaluation is conducted using a top-down approach. So we'll look into that as well. What is a top-down and what's a bottom-up approach, and why would you use one instead of the other one? And then we'll look into more of the depth about each of those. So assessment of gait, assessment of balance, what assessments to use. An example for assessment of balance, you can use your Berg Balance Scale, which evaluates a client's performance on 14 items common in everyday life. Or I can use a functional reach test, which that one is developed as a quick clinical measure of dynamic balance that uses a continuous scoring system to assess the risk of falls in the elderly. And then the assessment of praxis. So there are different kinds of praxis. So addressing apraxia, which means usually due to right brain damage and secondary visual spatial disorganization. So it's evaluating functionally by watching clients dress themselves. And then there's a constructional apraxia. So that one is using patients with constructional apraxia have difficulty with copying, drawing, and constructing designs in 2 or 3 dimensionals. So there are different kinds that I will have to look into. Some assessments for motor behavior. It's the motor assessment scale, the arm motor ability test, the Wolf motor function test, the motor activity log, the Fugger-Meyer motor assessment. So for each assessment, I'll just go ahead and, like I mentioned, go into depth and study what goes for each and how long it takes, which is better for what client. So after studying that, I will go ahead and study cognitive. I will look at the attention deficits having impact on daily function. So depending on what it does, There's a self-management strategy. There's a treating attention deficits, attentional control subsystems. So we'll look into that. And from that, we'll go up to the stages of memory. So there's attention, encoding, storage, and retrieval. And I will look into each description and what area of function is it being affected. And then we will look into the executive function as an impact on daily function. So executive disorder, and then the 4 domains of function, which are executive cognitive functions, behavioral self-regulatory functions, activation regulating functions, and metacognitive processes. And then we'll look into problem-solving training, goal management training, and metacognitive training. So for each of those, like it sees on the concept map, it has a description of what it is and how to do it. And then from there, we will look into the introduction. We'll talk about what is cognitive and how it affects a client's personal life on a daily basis. And it also has the models to guide our practice. So you want it to be client-centered. You want it to focus on a task that the client values or its interest, as well as the different approaches. There's 1, 2, 3, 4 approaches we will look into for each of this to guide us in our practice. And how to choose an appropriate assessment. So I will look into that to determine which assessment to use depending on the client. And then we'll look into awareness, the 4 compensation strategies, and then the level models of self-awareness. We'll look more into that using this concept map. Basically, it's to determine self-awareness. You can use questionnaires, interviews, rating scales, functional observations, comparison of self-ratings, and ratings made by others. So we'll look into that. And then we'll do more of a visual deficit, so the evaluation and treatment of it following a brain injury. So we'll look into how this is affecting us. What is it affecting? What assessments we need to do, and interventions, some possible interventions to use. And as we go down, we'll look at the visual field. What is a deficit? What does it limit on the patient? The assessments, and then the intervention. Like I mentioned for the other one, we'll look at how to intervene with the mobility and the reading of it. And then we'll look at visual acuity, so its ability to see small visual details, and it contributes to capability of the CNS to recognize objects. So we'll look at the deficits, and then we'll look at the limitations of it, and then of course, how can we help with this deficit, the interventions. And then OT, so we'll look at the evaluation, how to do it, why it's the 3 purpose of it, so to identify the limitation in activity or occupation, to link that limitation to the presence of a visual impairment, to develop an appropriate intervention plan based on the results of the assessment, and then the assessments of it. So observation, we'll look at the high contrast acuities measure for both for distance, and then the low vision test chart. So we'll do all those performance of the patterns. And then the interventions, there are 2 approaches, so we'll look at that. Either we're doing a remediation approach or a compensatory approach, depending on what we're trying to focus. And then we'll look at the ocular motor dysfunction. So we'll look at what it is, how is it training, and then the deficits. The deficits, we'll look at the limitations, what assessments we can use, and the interventions for it. And then we'll just go up here and we'll look at the eye, how it works. the role of vision. So we'll look at the CNN's overview, which is affecting it. And then the visual system is important for, so we'll look at why is it important for us to have a good visual system. And then any CNS lesions, depending on what it does and how is affecting our vision with it. And then, of course, a framework for assessment and treatment of a visual perception dysfunction. We'll look at that and see how that goes into a pyramid. And we'll do more optimizing vision and visual. So we'll do that as well. More assessments of the unilateral neglect and ocular motor dysfunction as a neurological condition. So we'll look more into that and the low vision and depending on aging as well. We'll look at that. So we'll go into each deficit and see how it affects our daily living. And then we'll look into a foundational review for perceptual dysfunction. So we'll look at this. We'll start with the general approaches to occupational therapy interventions, and then we'll look into more depth. So we'll look at the visual perception disorders and see how that is affecting us as well. An example is agnosia. It's a visual object recognition, refers to ability to verbally identify objects via visual input. And then we'll do a visual spatial perception disorder. An example is a figure ground discrimination dysfunction. So this one allows a person to perceive the foreground from the background in a visual array. And then it's what is a right-left discrimination dysfunction. So this one is the inability to accurately use the concepts of right and left. And then there's a tactile perception disorders. So this one can be a stereognosis. So it's a perceptual skills that enables an individual to identify common objects and geometric shapes through tactile perception without the aid of vision. And then we'll look at the motor perception disorder. So this one is more of a apraxia. We mentioned it earlier, so the addressing apraxia. This is the inability to plan effective motor actions required during the complex perceptual task of dressing one's upper and lower body. So we'll look at that as well as assessments of it. So this is how I'm going to study for the NBCall using my concept maps. I will go one-on-one and study each concept and see what I need from it, what I need to remember, where do I need help with it, and just go from there.